Hi, I'm Molly, and today I will be debating physician-assisted suicide. It is viewed as a hot topic by many, especially by me. I'm a nurse, so by many health personnel it is found interesting. But today I will be debating on the side that is against physician-assisted suicide, and I'll give you reasons why later. But physician-assisted suicide is carried out by a pill or an IV drug that is given by a doctor to the requesting patient, and which helps speed up the dying process. So many people find it illogical, and I'll give some of those reasons later, but many people find it logical because they want to help their loved one die in a peaceful way and to remove as much pain as possible. But many people like myself are against assisted suicide for obvious reasons. Like one, many people believe that physicians should not be able to play God and should not be able to pick a time of death for someone. So many people also believe that physician-assisted suicide is a slippery slope that could lead to euthanasia of just anyone and not just a dying person, which is a very scary thing that I believe, but it could eventually lead to that point. Two, physician-assisted suicide is against the Hippocratic Oath that doctors take before practice. And the Hippocratic Oath states that doctors should do no harm, and obviously helping a person die is doing harm and not doing what is best for the patient in the long run. So helping a patient die obviously inflicts harm and is against the Hippocratic Oath for doctors, and that's why many doctors do not believe in taking part of physician-assisted suicide. Another reason why is people that are dying are in a very vulnerable and emotional state, and many believe that they are not in a state of being where they can make such an important decision where they choose to commit suicide in a healthy manner, I guess you could say. But I personally believe, in my experience, I believe that dying people are very emotional and could make a mistake or a irrational decision because of the state they're in. So I believe it is very important for those people in that vulnerable state for them to be protected by their doctor and their health personnel. Let's see here. Physician-assisted suicide could actually hide elderly abuse as well. So that's a hot topic that mostly is found in nursing homes, but it can also happen in the hospital setting. But many people who are caretakers can become very fatigued. And by that I mean that caretakers can feel like they are apart from society and do not play a role in society anymore because they are so busy taking care of their loved ones, and actually it can cause depression and anxiety and many other health problems. So if they are in that state of taking care of someone and they are depressed, they may find that person they are taking care of better off dead, and can actually make decisions for them that could cause elderly abuse. So physicians also could make decisions for the elderly, which would be very wrong, but it could happen where doctors make the decision for the patient and allow them to commit suicide by physician-assisted suicide. And number 5, giving a patient the option of physician-assisted suicide could hinder the trust between the patient and the doctor, because it just giving them that option could make the patient question the doctor's intentions while in their hospital stay. For example, if a patient is dying and of like terminal cancer, for example, when the doctor mentions physician-assisted suicide, the patient may believe that the doctor wishes them to carry out those wishes, which is not wrong. It is not right. I'm sorry. It is not right for doctors to do that. But in many cases, it may be seen different in the patient's eyes, and many do not want the decision of suicide to be even mentioned. So I believe that that would cause a lot of stress on the elderly or anybody that is terminal for that matter. And then also, if suicide is even an option, the elderly may be easily persuaded to end his or her own life because they feel it is his or her own duty to protect their family from hurt and suffering. So many believe that they would be better off dead in order to protect their family from caring for them in the long run, which is a very sad thought as well. But my experience with dealing with the elderly, they do get very depressed because they live alone and they are not able to carry out their daily activities like they used to. So they get depressed and they often feel like they are better off dead. So I believe that also if they're in that state of being of wanting to commit suicide, I believe that they should not be able to just because they are in a vulnerable state, and I do not think that is acceptable for patients just to kill themselves off because they feel that it would be better for other people. I do not believe that. Although physicians assisted suicide may end of life suffering, it is a slippery slope that could lead to euthanasia and many other legal issues. So it is believed that physician-assisted suicide is unsafe for many reasons. Like I said, from a health personnel standpoint, I do not believe in it, but others have their own opinions. So just to recap, many people like myself are against physician-assisted suicide because they do not find it acceptable to play God. It is against the Hippocratic Oath that doctors undertake before practicing. People in the dying and vulnerable state should not be able to make decisions that could end his or her life. Number 4, it could hide elderly abuse. Giving the patient an option of suicide could easily persuade them to just commit suicide with physician-assisted suicide. And if suicide is an option, the elderly may be easily persuaded to end his or her own life in order to make it less of a burden for their family. So that is the end of my debate.